Robyn Lynn Sztyndor ESQ on why proactive legal compliance is every healthcare provider's best defense. Healthcare providers work where patient care, reimbursement, privacy, documentation, and government oversight intersect daily. A clinical decision may be sound, yet still create risk if the chart is incomplete or the claim is coded incorrectly. That is why Robyn Lynn Sztyndor ESQ views proactive legal compliance as more than a back-office function. For physicians, practice managers, executives, and medical organizations, compliance is a daily defense system. It helps reduce mistakes before they grow into audits, disputes, litigation, or government scrutiny. Based in Fort Lauderdale, Robyn Lynn Sztyndor has built her practice around healthcare defense, compliance, and fraud defense in Florida, New York, and New Jersey. Her work has included serving as lead healthcare counsel on significant healthcare fraud cases nationwide, providing opinions on compliance matters, claim data analytics, and billing and coding issues. Healthcare organizations do not need legal guidance only when something goes wrong. They need structure, review, and documentation before questions arise. The pressure facing healthcare providers. Healthcare is one of the most regulated sectors in the country because almost every business decision touches public money, private insurance, patient safety, or protected information. Providers must follow clinical standards while also managing payer contracts, reimbursement rules, coding guidelines, referral requirements, privacy obligations, employment concerns, and state licensing expectations. For independent practices and larger medical groups, that pressure can become part of ordinary operations. A new service line may require a billing review. A change in ownership may raise regulatory compliance issues. A pattern in claim data may draw payer attention. This is where ongoing legal oversight becomes useful. A healthcare defense attorney can help providers identify legal exposure before it becomes an emergency. For Sztyndor, proactive compliance is about helping providers move with better information and less risk. Why compliance must start early? Many legal problems in healthcare begin quietly. They may start with inconsistent documentation, unclear internal policies, unsupported billing practices, or a misunderstanding of payer expectations. By the time a demand letter, subpoena, audit notice, or fraud inquiry arrives, the organization may already be working from a weaker position. A strong healthcare compliance program creates a record of good faith effort. It shows that the organization has policies, training, supervision, and corrective procedures. It also gives leadership a way to find and fix issues before an outside party finds them first. This matters because healthcare fraud investigations often focus on patterns. Investigators and payers may look at claim volume, billing codes, referral relationships, medical necessity, and internal communications. Without documentation and legal review, even defensible conduct can be harder to explain. Robyn Lynn Sztyndor attorney guidance often centers on this point. Prevention is not passive. It requires regular review of how the practice documents care, submits claims, communicates with staff, and monitors compliance risks. The importance of documentation. Documentation is one of the clearest examples of proactive legal defense. In healthcare litigation, insurance audits, and fraud matters, the medical record often becomes the primary evidence of what happened, why it happened, and whether the service was supported. Accurate documentation does not mean adding unnecessary language or writing for fear. It means creating a clear, complete record that reflects clinical reasoning, patient condition, medical necessity, services provided, and follow-up plans. When documentation is vague, the provider may lose the chance to explain the care on its own terms. For physicians and medical practices, documentation habits should be reviewed before they become part of a disputed claim. Training staff, auditing sample charts, and aligning documentation with billing practices can reduce confusion. It can also help organizations respond more effectively when questions arise. As a South Florida attorney with experience in healthcare defense, Sztyndor understands how documentation and claim data are often reviewed together. A chart may tell one story, while billing data may suggest another. The goal is to make sure both are consistent, accurate, and supported. Medical billing and coding require oversight Medical billing and coding sit at the center of healthcare risk. Coding errors can occur for many reasons, including workflow gaps, changing payer rules, staff turnover, unclear provider notes, or pressure to process claims quickly. Even when mistakes are not intentional, repeated errors can create serious exposure. Proactive legal compliance helps medical organizations treat billing as a legal and operational issue, not just an administrative task. That includes reviewing coding practices, monitoring denial trends, training billing teams, and evaluating whether documentation supports the codes submitted. Sztyndor has provided expert opinions on claim data analytics and billing and coding issues. That background is important because audits rarely focus on one claim in isolation. They often involve patterns across hundreds or thousands of claims. When an organization understands its own data before an auditor does, it can make better decisions. It can correct mistakes, update training, improve supervision, and prepare a stronger response if payers or investigators question its practices. Preparing for audits and investigations. No provider wants to receive notice of an audit or investigation. Yet preparation should begin long before a letter arrives. Organizations should know who will respond, where records are kept, how communications will be preserved, and when legal counsel should be involved. Healthcare fraud investigations can move quickly. They may include subpoenas, interviews, document requests, claim reviews, and coordination among agencies or payers. In those moments, disorganized responses can create more risk. A proactive plan helps prevent panic. It gives staff clear instructions and helps leadership avoid inconsistent statements or incomplete productions. It also allows counsel to evaluate the scope of the request and protect the organization's legal position. Robyn Lynn Sztyndor ESQ has worked on matters involving major DOJ investigations, including Operation Brace Yourself and Operation Double Helix. Her experience as lead healthcare counsel and expert witness gives her a detailed understanding of how compliance, billing, data, and defense strategy can intersect. Legal guidance as strategic planning. Healthcare executives often think about compliance in terms of avoiding penalties. That is important, but the value is broader. Legal guidance can also help organizations make better business decisions. Before expanding a service, signing a contract, changing compensation, acquiring a practice, or entering a new payer relationship, providers should consider legal and regulatory impact. The right review can identify concerns early, when they are easier to address. Regulatory compliance also affects reputation with payers, referral sources, staff, and patients. A practice that takes compliance seriously can operate with more confidence because its leadership has considered risk before making decisions. For a healthcare defense attorney, this kind of work requires more than knowledge of statutes. It requires an understanding of how medical practices function. Sztyndor's role as full-time compliance officer for a major multi-specialty healthcare group in Miami adds an operational perspective to her legal work. That experience matters for practice managers and executives. Legal advice is most useful when it fits the realities of patient scheduling, clinical workflows, staff training, claim submission, and payer communication. A practical compliance culture. A compliance program should not sit in a binder that no one opens. It should become part of how the organization works. That means policies must be clear, training must be current, and employees must know how to report concerns. The most effective programs also include periodic review. Medical organizations should examine whether their policies match current operations. They should update training when rules or payer expectations change. They should document corrective actions when problems are found. Healthcare compliance is strongest when it becomes routine. Staff should understand that asking questions early is better than guessing. Providers should know that accurate charting protects both patient care and the organization. Leaders should create an environment where compliance concerns are taken seriously. This culture also helps during healthcare litigation. When a dispute arises, an organization with consistent policies, training, and oversight is better prepared to explain its decisions. Balancing defense and education. One reason proactive compliance matters is that many healthcare professionals are focused on caring for patients, not reading legal updates. Physicians and staff may need practical education that connects rules to daily work. Sztyndor's background allows her to help translate complex compliance issues into operational steps. That may include reviewing claim data, explaining documentation risks, or helping leadership understand what investigators may look for during a fraud inquiry. This educational role is important. When providers understand the reason behind a policy, they are more likely to follow it. When managers know which issues create exposure, they are more likely to correct them quickly. Robyn Lynn Sztyndor ESQ represents the kind of legal counsel healthcare organizations increasingly need: counsel who can defend, advise, and help prevent problems from developing. The best defense starts before trouble. For healthcare providers, legal defense does not begin in a courtroom. It begins in the policies, records, billing practices, training, and decisions that shape daily operations. Robyn Lynn Sztyndor's work shows why proactive compliance is both a legal safeguard and a management discipline. In a regulated industry, the strongest position is built before a dispute, audit, or investigation begins.